All right, Isabelle, welcome to the office. It's a pleasure to see you this evening. So we are going to go ahead and get started with your inspection, and I do just want to make sure that I have your consent today to touch your face and maybe a little bit of the clavicle area as well as your scalp in the front and possibly on the back depending on what we see. So I will be having gloves on at some point in the exam, but I just want to make sure that it's okay with you that I will be pretty hands-on with this examination. Okay, perfect. So to get started, I'm going to go ahead and do a little bit of a brief visual inspection. So I have a couple different kinds of light here, and they produce a different light depending on which one I'm using. So you're welcome to close your eyes. It is going to be a little bit bright. I just want to have a look at the overall integrity of your skin as well as your hair, okay? So just getting started, I'm going to shine my light over your skin, and right off the bat I'm seeing that your skin health overall is well intact. You do not have any active blemishes. Your skin does not appear overly congested. I do see some possible skin damage here. You do have some freckles, but that's okay. None of them look concerning or abnormal thus far. I'm seeing a very small mole here on the forehead that I'll take note of and we can come back to later. So having a look at the nose, not seeing anything abnormal thus far. Maybe just a little bit of slight dryness here, which is totally normal. Going over the eyelids, skin appears well moisturized, as well as on the forehead. Maybe a short onset of those fine lines, but that is totally normal. It does look like you get a fair amount of sun. Having a look over at this side as well. Do you see another small mole here? Lips are very well hydrated and do not appear chapped. And chest and clavicle area also appears well hydrated. No notes of excess dryness or creping of the skin. I am seeing quite a few freckles here on your shoulder, which we'll have a look at here shortly. And then of course having a look at the hairline, I do see maybe just a tiny bit of dandruff here at the front. Now this is your natural hair texture, correct? Mm-hmm. Okay, so your hair is very straight. Does look like you've had it color processed at some point, so I will have a look at the hair integrity and make sure that there is nothing abnormal going on there, but so far hair appears healthy. It is very thick and appears luscious in texture. It doesn't look overly dry as well as not overly oily, so your natural oils are producing well, but not so much that your hair appears unhealthy. Okay, so now that we have a brief overview of the overall health of your skin, I'm going to go ahead and put on a pair of gloves so I can have a little bit of a closer look. So excuse me while I get those out. Let's go ahead and have a little bit of a better look. I do see just a small, what appears to be cat hair here, so I'll just remove that for you. I'm just having a look at the texture of your skin. So I'm going to be doing what's called palpation. So I'll be forming some palpations on your face, and you're just going to feel me gently touching around with my fingertips, simply using my fingers as a way to gauge the overall health and texture of your skin. So you're just going to feel some slight movement along your face, and feel free to let me know if any of this is painful or uncomfortable for you. So just moving in different sections here, starting with the underbelly of your chin as well as along the jawline. Okay, And moving up towards the front of your ears, near the temple area, just kind of gently rotating my fingers, feeling for any abnormalities here. So I'm going to do a slight pinching of your cheeks, and I'm just looking for that natural buccal fat reaction here, which does appear to be intact. Looking for any notable creping of the skin around the fine lines, areas here where there would be an onset of smile lines, and I do see very slight lines here, but nothing that would be abnormal for your age range. So moving up to the forehead, just having a look at the integrity of the skin overall, I am noticing a little bit of dryness at the center of the forehead as well as between the brows. So it does appear that you could be using a little bit of a stronger moisturizer as well as sunscreen, so that is something that we can discuss. I would like to see you using a cold cream, especially at night, specifically in these kind of drier areas. And then obviously we want to make sure that you're wearing a sunscreen on a daily basis, regardless of the weather outside, anytime you're leaving the house or going to be in the car for extended periods of time. I would like to see you wearing sunscreen. So having a look at the integrity of the eyebrows, and hair does appear full and is growing symmetrically in pattern, so no abnormalities there. Also having a look at the eyelids and eyelashes. Eyelashes are very full and appear healthy. No signs of damage or breakage, which is great. Looking for any signs of infestation of mites in the lashes, and that is not notable. No suggestion of styes or other infections. Perfect. Just having a look at the nose, texture of the nose, smooth and well moisturized. Some slight dryness around the creases here. And then of course, going over the lips, they do appear very well moisturized and plump. No signs of pitting or peeling, which is great. Okay, just having a look at the hairline once again, going a little bit deeper now. Looking for any signs of abnormal color or raising of the skin, any bumps or anything that could indicate a rash, or anything more severe than just your regular dandruff, which is not notable so far. Okay, so I'm just going to pull this down slightly and have a little bit of a better look at your chest, just looking at the overall skin integrity here, making sure that everything is intact. Obviously, as I've told you in your previous visits, any products that you're using on your face you want to bring down onto your neck and chest as well. So just having a look at your neck, not noticing anything abnormal here. Palpating along the clavicle, all of that feels healthy. And I do see that you have an increase of freckles on this side. It's something that we want to look at. I do have a little bit of a different light here that I will use to have a bit of a closer look here. So we definitely want to make sure that if you're using sunscreen on your face, you also want to be using it on your neck and shoulders. This is a vulnerable area because it does stick out more prominently than other parts of the body, so it is exposed to the skin. So definitely want to make sure we are monitoring this area, looking for any moles that may appear abnormal. I do have a small mole here, but it looks okay. Just something to keep an eye on. It's not as notable on this side, which is interesting. So for whatever reason, your right side tends to get more sun exposure. Okay, and then just having a look again at your skin with this light. You do actually appear to have some slight discoloration here. Okay. And freckles on the face look totally normal and healthy. Nothing of concern there. So that one mole that we did see earlier Doesn't look concerning to me at all. It is mostly flat and round and symmetrical in shape. It is a very light brown color, and it does match the color of your freckles, which is a good sign. Again, small mole here, and same thing, looks totally normal. So keep your eyes closed for me. I'm going to shine this light very close to your eyelashes, and I'm just looking for, again, any signs of infestation or abnormality in the lash line. Any signs of excess drainage or anything like that, which I'm not seeing. Do appear to have some new growth in your lashes, which is great. It shows that the life cycle is continuing and your lashes are not unhealthy or dying off. Hairline overall is very healthy, aside from these few bits of dandruff that I see, but that's nothing to worry about, and I do have something that we can apply there topically. Okay. So all of that looks okay so far. So now I'm just going to do some deeper palpating here. So I'm going to go a little bit deeper with my palpations, just feel a little bit better at the overall health of your face. So now we're looking for anything that could be underneath the skin that would indicate any abnormalities. So give me just a second to tighten up my gloves and then we can proceed. Okay. So I'm just going to be palpating a little bit deeper here. This might be slightly uncomfortable, shouldn't cause you any pain. I kind of move down and along your jawline. Good. Feeling for any tension behind the ears. Not noting any swelling in your lymph nodes, which is great. Also going to feel for the lymph nodes that go down your neck as well as along your collarbone. And just ruling out any signs of inflammation or infection here. And I'm not feeling anything. Good. Okay. I do see a mole on your ear, so let me just have a closer look at that. Okay. So this one is obviously darker in color. The texture is seemingly normal, so it is very slightly raised, but not overly prominent. It is round and symmetrical. I'm not seeing any skewed edges or any black spots. So this one I would like us to keep an eye on, but it's not anything that I'm concerned of today. So maybe something that we'll look at for future visits and possibly we'll take pictures of just for future reference. But for today, it's not something that I think needs to be biopsied, so that's good. Let me just have a look at this side. Nothing here. Okay. Okay, so what I'd like to do now is go in with a couple percussions. So I have just a very small reflex hammer here, and I'm going to be using this to test the integrity of your skin. So essentially I'm going to be applying a slight amount of pressure to different areas of your face, and I'm just looking to see how well your collagen production is performing, okay? Maybe slightly diminished performance here. Okay. Just further indication of slightly dry forehead. Okay. I'm do that here on your cheeks, and right away I'm noticing a pretty significant difference. Your cheeks are very plump, your buccal fat is reacting as expected. Good. As well as on this side, all of this appears healthy. Testing right on those smile lines. Very good. So the only area that I saw slight indifference was, of course, here on the forehead. So let's do that along the clavicle as well. What I would like to do now is test for the reactivity of your skin. So I have a couple different ways that we'll test this. I have several tools here that will allow me to test your skin's reactivity, and essentially just testing your skin's ability to react to specific stimuli. So you don't have to do anything. You can just relax. You're just going to feel me placing different objects along your face. It can be swiping motions or patting motions, and I'm just looking again for a specific reaction from your face. Okay, so this might tickle just slightly. Just try to relax for me. Thank you. So I am seeing some of that notable dryness here, a little bit less of a reaction than what I would like to see. Elasticity of the eyebrows is intact. Just gently bring this underneath the eyes. Okay, so we have the clavicle and chest area essentially. I'm not seeing anything that indicating abnormal reaction, and I do just want to test your shoulder since we did see a difference in skin integrity from the right versus the left side. They do appear to be reacting fairly equally. Okay. So I'm just going to move along with a couple different tools that I have and perform the same kinds of tests. So I will be alternating between a few different brushes that I have, as well as this device that may look a little concerning, but this is a Wartenberg wheel, and essentially it's a very sharp, specific stimuli that I'll be applying to the skin. And it shouldn't hurt at all, but it is very distinct, so you will feel very sharp needles going across your skin. It will not puncture the skin at all, but it is a very distinct feeling, okay? just going to start this off going down the hairline, and did see a little bit of an overreaction there. I'm guessing because the skin on your forehead is a little bit drier than other areas of your face, this skin is slightly thinner than what we would like to see, which is why I saw the brief overreaction here. So comparatively, this area has significantly more fat, which would kind of cushion the sensation, versus here where the skin is a lot thinner. So that makes sense. Let me just toss that down. Clavicle area. I'm seeing a little bit of an overreaction here, and that is also where we saw the discoloration in your skin. So that might be something that we might want to look at with our light. Just have a little bit of a closer look here. So I am seeing slight pinkening of the skin, as well as a little bit of a raised texture. Just appears to be some superficial irritation. Doesn't look like a rash, but there is definitely a slight difference in skin texture in this area. Okay, so let's proceed, and I have two very fluffy, kind of little feathery brushes here that I'll be using to perform the same test, and we're going to do this bilaterally to test for an equal reaction on both sides. So you're going to feel just very gentle, kind of wispy pressure here. Good, and normal reaction here. Checking along the eyebrows. Good, as well as the eyelashes. Perfect. So again, the areas that we saw that were drier are having a little bit of that overreaction. And appears to be a normal reaction along this textured area, which is good. Thank you. Okay, so let's go ahead and move on to our next tool, and this time I'm going to purposely test two different stimulus. So I have an elongated version of the last tool that we used, so it's the same fluffy texture, the bristles are just longer, and alternatively I have a much wiry version in my left hand. So I'll be alternating and seeing if there's a difference in reaction from one side to the other. I did see a little bit of a different reaction on the left side. Again on the left side. Okay. So I am noting the areas that are going to require specific treatment. lastly, I have this tool that is very, very hard to feel. So it's just a very thin fishing wire. And I'm going to use this to produce a very specific reaction. So this is likely going to tickle. And I just want to make sure that all of your neurological functions are intact here. So I'm going to run this along your eyebrows. Looking for that consensual response among both sides. Good. Now I'm going to run this along your eyelashes. Please bear with me for just a second. Good. Perfect response there. I'm going to do that on the other side. Good. Okay. And then just quickly in the areas where we noticed the abnormal reaction earlier, I'm going to do this on the sides of your nose. And then in the area where we had that abnormal texture, that doesn't appear to affect your sensation at all, as well as your shoulders. Okay, good. Okay, so at this time, I would like to go ahead and move on to a treatment of these areas. So because I did see the abnormalities here, I think we can go ahead and apply some very specific therapies here to help induce some collagen growth and diminish some of these fine lines in this drier area. So essentially what I want to do is increase the water content of your skin, and the way we're going to do that is by bringing blood flow to the surface. So if you've ever had cupping done, this is very similar but on a smaller scale. So I have these very little cups here that will help me bring some of that pressure back up to kind of the surface of the skin. Okay, so what I'm going to do is use just a very small amount of lubrication here. And this is really just a little bit of salt water. So this is sodium chloride and it is sterile. The reason we use sodium chloride is because the saline will help rehydrate your skin. Okay, so what I'm going to do is just place a very, very small amount of this onto the affected areas of your skin, and then we will move from there. So you're going to feel a cold liquid on your forehead. I want you to just relax for me. Proceed with one of our smallest cups to start. So you're going to feel very mild suction on your forehead. And essentially what I'm going to do is move this along the areas where I'm noticing the excess dryness, and this is going to help rehydrate. So just gently dragging this back and forth. Perfect. Some more of our solution. And while I move on to another section, I am going to let this sit. So just relax for me. You're just going to feel some slight pressure as that sits on your skin. using this tool to rehydrate these areas. So it is going to produce a very small inflammation, possibly a couple lines of demarcation, and that's okay. The redness and discoloration will dissipate after just a few minutes. And the increased color is just showing that the reaction is apparent. So the redness and pinkening of the skin is just that increased blood flow that I was talking to you about. Just working that around these areas. Really working in. So let's add a little bit more of our solution. So I'm going to go in with a bigger tool. So same thing, it's just going to cover a wider surface area. So you're going to feel 2 of my cups on your forehead. I apply the suction. And we're just rehydrating these areas. Very gentle pressure. Good. Just holding your skin taut as I move this along. Very gentle pressure here. Good. Just going to do that one more time. Okay, so what I would like to do now is follow that up down here in these fine lines and areas of dryness that we found around your nose. So you're going to feel a very slight drop of water here. Good. So same thing here. I'm just going to come a little closer and do one area at a time. So just relax for me. Just increasing the oxygenation and blood flow to this area. Very gentle pressure here. Holding the skin taut as to not create too much discomfort. Good. Do the same thing on the other side. Good. Perfect. Okay. So now that we've got the oxygenation going and there's increased blood flow to these areas, what I would like to do is reduce inflammation. And in order to do that, I have a tool here that's going to produce a very slight vibrating. It's going to produce a very slight vibration. So let me just get these back in, and I will bring that tool out. So once again, I'm going to apply just a very small amount of this solution to the affected areas. So just a couple drops here. Okay. And I'm going to go in with my vibrating tool. So this is also cooling. It has been kept in the freezer, so it is very cold. I want you to just relax for me. This might tickle just slightly, okay? Starting on your forehead. Good. You're doing great. Okay. Now I'm going to move down around your nose, and this might tickle slightly. Just bear with me. Doing great. Good. All right, Isabelle. So that should help with the increased blood flow and oxygenation of your skin. So the discoloration will dissipate shortly, as I was saying. So as we let your skin relax for a couple minutes, I'm going to go ahead and have a deeper look at your scalp. So I'm going to have you lift your head for just a second so I can pull your hair. Good. Just pulling your hair out so that I can have a little bit of a better look. And I'm going to start by looking at the overall texture and just kind of overall integrity and health of the hair shaft. So just pulling out a small section here. And of course, having a look at the hair itself, I do see the line of demarcation here where you did have your hair color processed at one point. So having a look at the areas that are highlighted as well as the areas that are not. For any signs of increased breakage or damage, specifically to the ends of the hair, which I'm not seeing. Good. So just gonna have a look at the scalp as well, looking for anything that can be abnormal here. Scalp is normal in color and texture. No notable signs of infestation, but I will just have a closer look with my light. Good. of this appears to be normal. Just having a look at the hair with my pen light. Okay, so I'm going to go in with my comb, and I'm just using this to separate a very small section of your hair. Good. Overall, your hair is very healthy. Not seeing any signs of increased breakage or weakening of the shaft. No signs of excess hair loss, and there are absolutely no signs of infestation. So nothing like lice or ticks or anything like that. I do see just a very slight, very mild case of dandruff. Nothing that would be anything of concern. So I'm just going to perform a test of the strength of the hair shaft. So you're going to feel me kind of twirl your hair around my fingers and then perform a slight tug. Just testing to see if there's any weakening of the hair follicle. Okay. And now with the hair shaft. So now that I've tested the integrity of the hair on this side, I'm just going to do that again with the hair on the front, kind of crown portion. And the reason I'm testing here as well is because this area tends to be at risk for something called traction alopecia. And essentially what that is hair that is put up in a ponytail a lot, or any hairstyle that has significant traction placed on the hairline portion is at risk for alopecia or traction alopecia, which is baldness caused by pulling of the shaft. So I'm just going to give a slight tug here and make sure that there are no abnormalities in follicle strength, and all of it appears to be normal. So the shaft is not showing any signs of increased weakening or gumminess. There is no stretch, which is good. So we do want to see a certain amount of elasticity, but not when the hair is dry. And your hair appears very healthy. And as I comb through with my comb, I'm not seeing any signs of excess breakage, which is good. So we do expect to see 1 or 2 hairs come out, but obviously if we were to see several, we would be slightly more concerned. So just get 1 hair, which is completely normal. So what I would like to do now is just apply a spot treatment to the very front portion where I did see a slight sign of dandruff. So I will go ahead and apply that same saline solution, and essentially what this is going to do is help reduce the inflammation of the scalp. The salt in the saline will help kind of combat some of the dryness from the dandruff. And what I would like you to do when you get home is just wash your hair with your regular shampoo that you would use, and that should help kind of combat this. And what you can do is either order online, or you can actually make it yourself. If you boil some water and then add some salt, you can make your own sodium chloride solution. You do just want to ensure that it is sterile and that you're keeping it closed so that it's not exposed to air. And if you apply this to your scalp about once a week, it will help combat some of that dandruff. Okay, so this is going to be a little cold. I'm just going to apply a couple drops and rub it in, and then go a couple sections at a time. So just applying the solution here. You don't need very much, and I am only applying it to the scalp. So Now that I've applied, I'm going to go ahead and use my comb to just kind of brush that through and make sure that we are distributing this evenly. And I'm just going to go in with my fingers and make sure that's thoroughly rubbed in. So now I will separate this and go into our next section. Making sure to rub that in. I did see just a little bit of that affected area here as well, so I'll just apply some of that here. So it appears as if the solution has been evenly distributed, and I do have about half a vial left. So what I'll do is pack this up for you so that you can take it home, and you're welcome to either apply the rest of the solution or you can hold on to it until next week and then apply it after you wash your hair. Leave it in for at least 30 minutes and then you can proceed with your normal hair care routine. Okay, so other than the little bit of increased dryness that we saw in the forehead, there really was nothing notable for today's visit. As I stated, I do want to keep an eye on this mole that you have on your ear, so that's something that we will be documenting and looking at when you come in for your next visit. But other than that, there's nothing of concern, there's nothing for you to worry about. Make sure that you are implementing a cold cream into your skincare routine, specifically at night. We want to overhydrate this area for now until it regains some of that elasticity. And then of course, your hair was great. There was nothing too notable aside from the very mild dandruff, which is easily taken care of with the saline solution. So if you don't have any other questions, that's really all I have for you today, Isabelle, okay? Okay, perfect. Perfect. So I will go ahead and go in your patient portal and schedule your appointment for next year, just so you have it as a reminder. And if you would like to change the date, you can always do that manually. And then I'll go ahead and put in for the submission, okay? All right. Well, thank you so much. Have a good evening.
Thank you.